Hello, ladies and gentlemen. Welcome to my YouTube channel. Another episode on my channel. Today, we're going to be discussing cardiac failure, specifically congestive cardiac failure and its management. Your presenter here, IDE Henry, here to take you through CCF. Stay tuned. Don't forget to like and subscribe. Without wasting much of your time, let us quickly go into the topic. All right, I have a question with me, and my question reads: a 46-year-old housewife is brought to your medical ward with complaints of tiring easily and breathing difficulties. After examination, a diagnosis of congestive cardiac failure is made. Question A: define congestive cardiac failure, 5 marks. Question B: state 5 predisposing factors to CCF. Right? Question C reads: state 5 main clinical manifestations that Mrs. Longwe may present with. And then D: identify 5 problems using a nursing care plan and demonstrate how you are going to solve them. 50 marks. And lastly, explain 5 points that you would include in your IEC that you would give to Mrs. Longwe on discharge. Without wasting much time, let us quickly dive into answering. How do we answer question A? Congestive cardiac failure, in the simplest way, can be defined like this. This is a heart failure that is characterized by structural or functional abnormality of the heart, leading to inability to effectively pump an adequate amount of blood to meet the body's metabolic demands, both at rest and during physical exertion. It is characterized by shortness of breath, fatigue, fluid retention, reduced exercise tolerance, and lastly, increased heart rate. We proceed. 5 predisposing factors to congestive cardiac failure. If you're enjoying this video, pause the video, like the video, subscribe for more. Alright? The first predisposing factor is that of coronary artery disease, which is also abbreviated as CAD. So this is caused by atherosclerosis, which also means narrowing of coronary arteries, which causes reduced blood flow to the heart muscle, and this weakens them, eventually leading to heart failure. Secondly, hypertension, also known as high blood pressure. Persistent high blood pressure places increased strain on the heart, making it work hard to pump blood, and this extra workload can eventually weaken the heart muscle and contribute to the development of congestive heart failure. Previous heart attack. So a previous heart attack can leave a scar tissue in the heart. This compromises the ability of the heart to pump blood effectively, and this can damage gradually, leading to heart failure. Fourthly, the other predisposing factor is that of diabetes mellitus. So uncontrolled diabetes can damage the blood vessels and nerves supplying the heart, because high levels of sugar can cause demyelination, and also it impairs the heart's function. It also causes increased risk of coronary artery disease to individuals with diabetes, further rises as the likelihood of developing congestive cardiac failure. In short, diabetes mellitus damages blood vessels and the nerves that supply the heart due to demyelination of nerves. Lastly, valvular heart diseases such as structural abnormalities rheumatic heart disease. In this case, the structural abnormalities or malfunctions of the heart valve, such as aortic stenosis, mitral regurgitation. Mitral regurgitation simply means backflow of blood from the right ventricle back into the right atrium, because the valve does not completely close, and that is known as stenosis. So this can increase pressure or volume overload in the heart chambers, leading to heart failure over time. Ladies and gentlemen, having looked at that, let us state 5 main clinical manifestations that this patient will face or present with. We can mention the following: fatigue and weakness. Remember, the rule of stating is that each explanation is equivalent to 5 marks. 2 marks for the heading. You number your headings nicely like that, and then you explain. Great. So Mrs. Longwe may complain of tiring easily, of which in the stem we saw that she's tiring easily, feeling weak and having a decreased ability to perform her usual daily tasks. Alright? This can be attributed to reduced cardiac output and inadequately delivering of oxygen and nutrients to the body tissues. So when the oxygen is not enough and the glucose or other nutrients is not enough, cellular respiration is not going to effectively take place, and hence there will be body weakness and fatigue. Also, shortness of breath, aka dyspnea. She may present with difficulty in breathing, especially during physical exertion or even at rest in severe cases. So this symptom is due to fluid accumulation in the lungs, which is the pulmonary congestion itself, caused by the heart's inability to effectively pump blood. Okay? Then the third clinical manifestation that we can include, ladies and gentlemen, to get all those nice 15 marks to ourselves is that of edema. So write the following. Mrs. Longwe may develop peripheral edema, particularly in the legs, ankles, feet, as well as increased fluid pressure in the blood vessels. This can lead to leakage of fluids into the surrounding tissue, and hence you're going to see the swelling. All right. Also, coughing and wheezing. A persistent cough, often accompanied by wheezing, can be as a result of fluid accumulation in the lungs, which can cause irritation and congestion in the airways, and that can be a manifestation. And lastly, ladies and gentlemen, the fifth one is that of rapid weight gain. So due to fluid retention, Mrs. Longo may experience rapid weight gain, which is unexplained, and this weight gain is primarily due to accumulation of fluids in the body and it can occur over a relatively short period. Well, we can even add a sixth so that you can have more to choose from. Orthopnea. Okay, so what does orthopnea mean? Orthopnea refers to difficulty in breathing while lying flat. Orthopnea can occur due to a redistribution of fluid in the body when lying down. It can lead to increased fluid accumulation in the lungs and worsening of dyspnea. So orthopnea means, in simplest terms, the difficulty in breathing that occurs except in upright position. We proceed, ladies and gentlemen. The main take and the main part of this video, the nursing care plan, the management, which is 50 marks. So the rule of writing a nursing care plan is you identify the correct problems, you state your goals according to the SMART principle, you put your diagnosis nicely, which should contain the problem, its cause and its manifestation, and your interventions, which should be relevant and rationable, and lastly your evaluation, which should be very specific and in relation to your objective. Let's start. The first problem, ladies and gentlemen, that this patient is going to present with is that of ineffective airway clearance. Similarly, if you had watched my video on management of pneumonia, you're going to find that this problem is also going to be found in patients with pneumonia. In the same case, even patients with congestive cardiac failure have ineffective airway clearance. So the ineffective airway clearance is related to increased tracheobronchial secretions evidenced by dyspnea. All right? The patient will have airway clearance within 2 hours of nursing care. Isn't that smart? And then your interventions can be as follows. Number 1, you can say, I will humidify air by a boiling kettle to loosen secretions. Nicely. I will encourage hydration to loosen secretions. Okay. I will teach the patient coughing exercises to clear the airway from secretions. Fourthly, I will perform postural and chest percussion to remove secretions from the airway, hence relieving airway clearance. And also evaluation. The patient has effective airway clearance within 2 hours of nursing care evidenced by absence of dyspnea. We proceed to the second problem. Please at any point feel free to pause the video and take some short notes for your own detailed understanding. We proceed. Fluid volume overload. In pneumonia, we had fluid volume deficit, but in congestive cardiac failure, we've got fluid volume overload. Let us understand this in an easier way. This is edema. But scientifically explaining this, we're supposed to state it like fluid volume overload because it definitely is fluid volume overload and edema is a manifestation. Let us read this. Nursing diagnosis. Fluid volume overload related to decreased cardiac output as evidenced by edema in lower extremities. Your objective. The patient will have no edema or other signs of fluid volume overload within 4 or 24 hours of nursing care. Like I said in the previous video, fluid volume deficit cannot be corrected in less than 24 hours. Same applies with fluid volume overload, alright? Then your interventions can be as follows. Firstly, I will monitor the patient's fluid intake and output closely to assess their fluid balance and identify any early signs of fluid overload. That's number 1. Number 2, I will encourage the patient to limit their sodium intake to prevent fluid retention, alright? Number 3, I will elevate the patient's limbs when they are sitting or lying down to help reduce edema. This is going to reduce edema by the use of gravity, as this is going to improve venous return, alright? Then fourthly, I will administer diuretics as prescribed to help the patient eliminate excess fluids. Examples of this can be that of furosemide, which is also known as Lasix, okay? The dose can be 20 milligrams, 20 to 40 milligrams, to be given twice daily or once daily. It can be IV or you can give it orally. Then your evaluation. The patient has no edema or other signs of fluid volume overload within 2 hours of nursing care, evidenced by absence of edema in lower extremities. Remember, the English in this part of the nursing care plan should match the English in the objective, because this is in future tense and this is in present participle, right? Then we proceed to the second problem. And our second problem is that of anxiety, okay? So anxiety related to unfamiliar ward routines, evidenced by patient repeatedly asking questions, isn't that so? Your objective: the patient will be allayed of anxiety within 4 hours of nursing care. Your interventions: I will allow the patient to ask questions and express concerns to allay anxiety, as the first one. Your second can be: I will orient the patient toward environment, equipment and tubings to allay anxiety. Thirdly, I will explain all procedures done to allay anxiety and promote cooperation. Fourthly, I will allow the patient to be with their support person, as this promotes a sense of belonging and it allays anxiety. And your evaluation may be: the patient has been allayed of anxiety within 4 hours of nursing care, evidenced by cessation in repeated questions. We move on to our other problem: risk of acquiring hospital infections. So risk of acquiring hospital infections related to hospitalization. The patient will be prevented from acquiring hospital infections throughout hospitalization as our objective, and our interventions are as follows. Firstly, the first rule always applies: I will wash hands at all intervals of nursing care to prevent cross-infection. I will change the patient's linen whenever soiled to prevent infection. Thirdly, I will perform assisted tub baths and bed baths on the patient to prevent infection. And lastly, I will administer prescribed prophylactic antibiotics to prevent secondary infections. And then your evaluation. The patient has been allayed of anxiety within 4 hours of nursing care. As of before, forgive me for that error. The patient has been prevented from acquiring hospital infections throughout hospitalization, as evidenced by absence of new symptoms. Alright, having said that, ladies and gentlemen, the other problem is that of impaired gaseous exchange. So impaired gaseous exchange related to decreased cardiac output, as evidenced by shortness of breath and orthopnea. Your objective should be SMART. The patient will maintain adequate and improved gaseous exchange within 40 minutes of nursing care, alright? Then your interventions: number 1, I will monitor the patient's respiratory status closely to assess their oxygen saturation levels and identify any early signs of respiratory distress, as your first one. Secondly, I will position the patient in semi-Fowler's position to help improve breathing. Thirdly, I will encourage the patient to breathe deeply and cough effectively to help clear mucus from their airways. And lastly, I will administer oxygen therapy as prescribed to help the patient maintain adequate oxygenation or oxygen saturation levels. What is our evaluation going to be? The patient has maintained adequate and improved gaseous exchange within 40 minutes of nursing care, as evidenced by absence of shortness of breath. Ladies and gentlemen, we proceed to the other part of management of our care plan, okay? What is the medical management of congestive cardiac failure? Ladies and gentlemen, since this question was mainly focused on the nursing care plan, see you in my next video where we're going to cover the management of CCF following medical management, which is 15 marks, and nursing management. Until then, ladies and gentlemen,